lumbar puncture, sometimes called a spinal tap, is a test performed on your lower back. Your test will be performed by a doctor or a qualified nurse. The doctor or nurse will insert a hollow needle into your lower back to get to the fluid around your spinal cord. This is called cerebrospinal fluid. A sample of this fluid contains a lot of information. It can help doctors learn more about you or diagnose certain conditions. Before your lumbar puncture, you may be given specific instructions about how to get ready for it. Bring a list of medications you are taking to your appointment. You will be able to ask the doctor or nurse any questions you may have. When you arrive for your lumbar puncture, a member of staff will greet you and take you to where you will have the procedure. You may be asked about your health. A nurse may measure your height or weight. You may be asked to change into a gown. The doctor or nurse will explain what will happen during the lumbar puncture, including things that could go wrong. The doctor or nurse and the staff are there to help you understand what to expect and make you feel comfortable. Bring up any questions or concerns you may have. To help the doctor or nurse find the right place to put the needle, you will be asked to lie on your side with your knees pulled up to your chest. Some people have a lumbar puncture sitting up and leaning forward. Both of these positions make it easier to find the space between the small bones in your backbone. To keep everything clean, the doctor or nurse will wash his or her hands. They will also put on gloves. After checking in to be sure you feel comfortable, the doctor or nurse will touch your back to find the right place to put the needle. This can take a little bit of time because they want to find the best spot. Be sure to ask any questions you have during the procedure. The doctor or nurse will clean the lower part of your back with iodine or soap. If they use iodine, this part of your back may look orange after the procedure. The doctor or nurse will place clean towels or a drape around the lower part of your back. They may also place a plastic sheet over your lower back. To help make the lumbar puncture more comfortable, the doctor or nurse will use a needle to give you a medication that will make your skin numb. You might feel a small sting. After making sure that your back is numb and you are comfortable, the doctor or nurse will place a hollow needle into the clean spot on your back. This needle is hollow so it can get to the fluid around your spinal cord. You may feel some pressure as the needle goes in. Be sure to tell your doctor or nurse if you feel uncomfortable or have any questions. The doctor or nurse will collect some of the cerebrospinal fluid in a small tube. The amount of fluid they collect will depend. They may need to collect more than one tube. When the tubes are filled, a staff member will label them and place them into a safe area. The doctor or nurse will take out the needle and put a bandage on the spot where the needle went in. You may be asked to lie still while they take the towels and sheet off your back. When you feel comfortable, the doctor or nurse will help you sit up. After the lumbar puncture, the doctor or nurse will go over the best way for you to recover. You may need to rest for part of the day and limit activities that take a lot of effort. You may have a headache or some back pain afterwards. The doctor or nurse can tell you if you can take pain medications to help. Before you leave, the doctor or nurse will go over things you should look for that might mean there is a problem from your procedure. Although not common, call your doctor if you experience any of the following things: fever and headache that won't go away, numbness in your legs, bladder problems, or confusion. If you have any questions or do not understand something, be sure to ask. You should also ask about when you will hear about the results of the test.